Hi, my name is Naomi. I'm a patient at Dr. Jeff's. I am a nurse by profession, and I've had a lot of back pain for years. I finally came to Dr. Jeff, and he recommended spinal decompression after all the other treatments that I've had, and I no longer have pain down my left leg, which I've had for years. Working with Dr. Jeff is great because he makes sure that he feels strongly that you're appropriate for this spinal decompression. It will help you, and he won't recommend it if he does not feel that way. So you can feel safe with him.
But what we found is that much of the time radiating pain into the hips, groin, or legs, while it doesn't respond to many of the other ways, the traditional ways you've been treated with drugs or physical therapy, it's frequently from bulging or herniated discs. And I'm going to talk a little bit about how we treat those problems.
Okay, so these are some really good examples of how discs become damaged over time and what they actually look like. So what I want to show you here is a healthy disc. The first one over here, this is textbook normal. If you look, you can see nice spongy disc material. There's no spurring like you see over here. This is called calcification and spurring. It's basically, this is what arthritis looks like. So over time, if you get damaged, what you have is a diminished disc height, so it's putting pressure from above this way, okay? Putting pressure this way, down. And when that happens, these nerve roots over here, see those little white yellow things? Those are called nerve roots. They become compressed. Over time, if you allow that compression to happen for long enough, then what's going to happen is the body's going to look at that, it's like a weakness, and what it'll do is start to form spurs. And those spurs, let me get a little bit closer here, we can show you what we're talking about. If you look, those spurs will then put pressure on the disc material. And when that happens, you have pain. And the only way that this area here can be healed is if you take the pressure off. And the only way to do that is through spinal decompression. So what happens is you start off healthy in life, right here, textbook normal. You get damaged, injured somehow, you hurt yourself, and you start to get pressure on those discs that cause pain. Then you wait 20 years without doing anything. You end up phase 2, where you start to get arthritis. Now this is where most people end up around age 50 years old, 55, hopefully not any earlier. But when you get to this stage, that's where you have chronic pain and the nerves are now compromised. And if you look, they start to bulge out. The discs start to bulge out on the nerve and send pain down your legs. So we want to keep you from getting here. All right? If we treat you here, we can stop you from getting here. And that's the whole trick, is to keep you from getting to the point where you are not incapacitated by spinal degenerative disc disease. And spinal decompression makes a large difference and can physically cure a disc and get it back to working order. So this is called the spinal decompression unit, and Lily has most generously volunteered to be our patient here today. And what you see is a unit that's going to basically take her spine and slowly pull it this way. And if you know anything about discs, you know that they're under a compressive load. And the weight of your body puts pressure on those discs. And when that happens, those discs can bulge or they can break loose. I always compare it to a jelly donut. As weird as that sounds, a jelly donut, if you step on it really hard, the jelly will squirt out. That's a herniation. But if the jelly just bulges out, it can put pressure on those nerve roots. And when it puts pressure on nerve roots, pain will go down the legs, it'll be achy, it'll be aggravating, and it will not go away until you decompress those joints. So what this does is, it takes, usually we use about half your body weight, and there's a pulling effect here, going this way, of half your body weight. It'll go for a certain amount of time, and then it'll relax. And what happens is, it'll do that over a cycle of about 20 minutes, and that causes a pumping effect to occur. The disc is 70 to 80% fluid, but if it's under a heavy load, if it's being compressed, then the disc material can't heal. So by taking the disc and allowing pressure to come off of it, and then have it settle, and then come off of it, if you do that over time, it takes all the pressure off the disc, and the disc can rehydrate, and you can get nutrients to the disc, and it can heal. Now the disc and the surrounding nerves, they need fuel, and we use oxygen. And that's what the disc needs. So basically she's on oxygen here too. She's on a cannula hooked up to an oxygen concentrator where she's getting 5 liters a minute. So those nerves and that disc, that cartilage, is getting its fuel that it needs, and it's also being decompressed. The other thing you have to realize is that disc material is made out of what's called type 2 collagen. And type 2 collagen responds very, very well to laser therapy, light therapy. And we have some real high-tech lasers that we use. Not right now. What will happen is we'll go through the 20-minute treatment, and then we put you on laser therapy after. It takes about 90 seconds. So the combination of decompression, laser therapy, and oxygen, the studies show that 85% of people that have this therapy done report feeling better afterwards. These same people, they've done studies that they look at the people a year later, and more than 85% do better a year later. So after we decompress you, it takes about 15 to 20 visits over a 2-month period. After we decompress you and we allow that tissue to heal, it actually gets better even when you don't have the treatment. So this is something that is long-lasting and can really make a big difference in your life and allow you to do all those things that you couldn't do before because those spinal discs were continually being compressed.
But a very important note, spinal decompression has been successful with even the most severe cases, even when nothing else has worked, even after failed surgery.